Healthcare Summit 2010 is one for the books. President Obama, along with Democratic and congressional leaders from the Republican side, met for 6 hours around a square table. The plan to create a healthcare reform bill. Senator Max Baucus, a Democrat from Montana, insisted the two sides were quite close to a deal, while Republicans demanded a healthcare reform redo. Arizona Senator and former presidential candidate John McCain went head-to-head with the president.
When my constituents and Americans now who overwhelmingly reject this proposal say go back to the beginning, they want us to go back to the beginning.
We're not campaigning anymore. The election's over.
I'm reminded of that every day.
We can spend the remainder of the time with our respective talking points going back and forth. We were supposed to be talking about insurance.
Joining me now with his thoughts is Rebel Cole, professor of finance at DePaul University. Great to have you on the show. And was this meeting productive?
It was interesting. It was a whole lot of talking and not very much listening. That said, that it's nice that they took a bipartisan approach. This is where they should have started last February rather than going behind closed doors for a year and doing this well, just with the Democrats on board.
What do you think is likely to come out of this meeting?
I'm afraid that this is simply to provide political cover, that the Democrats are then use the budget reconciliation process to push this through without any Republican support. I hope that's not the case, but I think that's what it's looking like right now.
What do you think is at the bottom of this politicking? Is it just a matter of the Republicans not wanting the Democrats or President Obama to look good by coming out with health care reform in this country?
Certainly there's politics involved, politics in Washington. Gosh, imagine that. But that said, I think there's a lot that we can agree on. I think that the Republicans would like to see that we had portability of insurance, that we had coverage of pre-existing conditions. The problem with portability is, other than a government option, the only way we're going to get there is by letting the people buy the coverage. As long as your employer provides your insurance coverage, you're not going to have true portability.
Well, President Obama seems to believe that Republicans do want health care coverage for all Americans, but he says the big sticking point is that Republicans are concerned that the insurance companies will be overregulated. Do you agree with that?
I'm certain that's a concern of Republicans, but I think the overriding concern is that of cost. This is cost out at $950 billion. My guess it's going to come in at probably triple that, $3 trillion over 10 years, because the CBO always underestimates the cost and overestimates the cost savings.
Do you think it was a good idea to put this summit on television?
Kabuki theater. That's about all it is.
It's just kind of crazy. Well, at least the two sides are talking, so that's
Absolutely.
a good thing.
That's a good step in the right direction.
Thank you very much, Rebel Cole, DePaul University.